How to tell viral from bacterial infections in children. Imagine your child has a fever and a cough. How do you know if it's just a common cold or something more serious like a bacterial infection? Understanding the differences can help you decide when to see a doctor and when to wait it out. Viral infections are very common in children and usually cause symptoms like a runny nose, cough, mild fever, sore throat, or sometimes a rash or stomach upset. These symptoms tend to develop gradually and usually improve within 1 to 2 weeks without antibiotics. The fever in viral illnesses is often moderate and may come and go. Since viruses spread easily among children, especially in places like daycare or school, good hygiene and rest are key. Treatment mainly involves supportive care such as plenty of fluids, rest, and over-the-counter remedies to ease symptoms. Sometimes antiviral medications are used for specific viruses like influenza if treatment begins early, but most viral infections resolve on their own. Bacterial infections tend to show different signs. They often cause symptoms that are more localized and persistent, such as ear pain, sore throat especially if caused by bacteria like strep throat, or difficulty breathing if the sinuses or lungs are involved. Fever from bacterial infections is usually higher and lasts longer than in viral illnesses. If symptoms worsen or do not improve after about 10 days, it could be a sign of a bacterial infection. Unlike viruses, bacteria can be treated with antibiotics, but these should only be used when a healthcare professional confirms a bacterial cause. Overusing antibiotics can lead to resistance and side effects, so they are not given for every illness. To tell the difference, look at how long the symptoms last. Viral infections tend to get better within 1 to 2 weeks, while bacterial infections may stick around or get worse. Notice the fever pattern. Moderate and fluctuating suggests a virus, but a high, persistent fever might mean bacteria. Also, consider where the pain or swelling is. General symptoms like a runny nose and cough point to a virus, while localized pain in the ear or throat suggests bacteria. If your child has a high fever above 38 degrees Celsius, trouble breathing, seizures, unexplained rash, or is not drinking enough fluids, it's important to see a healthcare provider promptly. They can perform a physical exam and sometimes tests to determine if bacteria are involved and whether antibiotics are needed. In the context of treating childhood illnesses, it's crucial to avoid giving antibiotics unnecessarily. Using antibiotics when they aren't needed can harm your child by causing side effects and making bacteria resistant to future treatments. Healthcare professionals relying on their clinical judgment and sometimes laboratory tests to confirm bacterial infections before prescribing antibiotics. Remember, every child is different, and only a healthcare provider can give the right diagnosis and treatment plan. If you're ever unsure, it's always safest to consult a doctor to ensure your child gets the appropriate care and recovers quickly.